My name is Louie. I'm a spine surgeon at Virginia Mason Medical Center. I chose this specialty not just because I think the spine is amazing and the pathology is incredible and the interventions and surgeries are a lot of fun, but it's the patients at the end of the day. I understand what they're going through. I feel like I have a connection with these types of patients, and these are the people that I've been drawn to the most. So I treat a wide range of spine conditions, whether it be from a recent injury or a chronic degenerative process. Also more chronic or more complex presentations. So if you have a deformity of your spine or a tumor that's been affecting your spine, these are all different conditions that I treat. Yeah, so I think I was lucky enough to train under some of the world's experts in spine surgery, and something that I've taken away from them is these minimally invasive spine surgery techniques. And there's a lot of ways to do spine surgery, but I think there's a lot of value in preserving muscle and decreasing blood loss, not just so that the surgery goes well, but for the recovery period. And so I'll be focusing heavily on the minimally invasive techniques. Research is very important to me. I think there's a lot of value in always wanting to learn more and to get better, and especially in medicine, how can we continue to provide treatments for patients that are effective and safe? And so in my practice, I find it very important that everything I present is evidence-based and there's research to support it. And I also, with this team, love participating in research studies. And so I tell the patients, this is a journey we can embark in together. We have opportunities to join in on trials, to participate in research, to help give to some of the projects that we're participating in. So it's a key element in my practice. There's a lot of hope in medicine right now. In spine surgery specifically, I think the technology is it's just blossoming at this point. And it's not just the advances themselves, but the research that shows that they're both effective and safe for patients. And so as the technology continues to grow and is proven, these are areas that I'd like to incorporate into my practice. Part of medicine is the struggle. And I think something that I always remind myself is, that we're in this together. The pain, the struggles, the difficulty, I feel that burden with my patients. But they also need to know that when they're doing well and they have these victories and the joys, that I also get to share with them in that. And so we're in this together. My patients inspire me every day. I think their drive to get better and their perseverance and their courage and strength are something that continues to encourage me in my work with them as well. My goal with every patient is to treat them like my own family members. If the patient were, in fact, my mother, my father, my brother, my sister, what would I tell them? And I've learned that the patient deserves to know exactly what I'm thinking and why I'm thinking. So my goal is with all of these interactions is that they have a full understanding of why I'm saying what I'm saying. But at the end of the day, when it comes to our recommendation, I'm treating them like one of my family members and what's best for them. Everyone who comes in, I want them to know that we're in this journey together. That despite their pathology or despite what they're going through, that they've now entered this physician-patient relationship, and I want to carry them through this. And so their pains and their struggles and their joys, we're going to experience these all together. Yeah, the team approach at Virginia Mason is incredible. My patients need to know that I am not an expert at everything, but I get to work with people who are. And so when they come with whatever they're going through, we'll go back as a team of different specialties, of different backgrounds, and we can all bring our minds together as to how to best treat this patient and take care of this patient. I'm a hometown kid. I grew up in this area. I spent a few years away for additional training, but I wanted to come back and work for the community that I grew up in. And I think just the exceptional care, the team-based approaches, and the community values that Virginia Mason holds provides me with the best opportunity to serve this community, and I'm just very happy to be back here. One of the biggest ways that I reach out to my patients is, trying to figure out who they are as a person, like what are they bothered by the most about what they're suffering through? What do they want to get back to doing? And this way we can do everything we can to try to mold our interventions and our therapies and our treatments to get them back to what they want to do. When I'm not working, I like to spend time with my family and peruse the local parks and beaches. I'm a devout Seattle sports fan, so I've ridden the roller coaster of the many lows and the few highs recently. As an eternal optimist, I always tell myself, you know what? I think this is going to be the year. I also love the outdoors, and so when you see me, you'll probably hear me telling you about my most recent outdoor adventure.